With a persistent pain in my left shoulder, I headed for Vergelegen Mediclinic X-ray department. Armed with the X-rays, it was on to Dr. van der Berg, the orthopedic surgeon. He discovered this bone spur, which was the cause of the problem. So an arthroscopy was necessary.
So arthroscopy is a procedure we do as orthopedic surgeons, which basically means if you divide the two words, arthro, meaning the word joint, and scope is to look into. So it's an arthroscopy looking into the camera, has a light of its own, and you can look anywhere inside the shoulder and basically firstly look, meaning making a diagnosis, finding anything that's wrong, and then secondly start repairing things. So you've got tools that are designed to go through 5-6 millimeter skin cuts, where we go inside and repair things or clean up things or remove bone spurs. The shoulder is visualized only by inflating it with high pressure water, otherwise you can't see inside. So we inflate the shoulder, then you can see inside, and we operate on a big screen in front of us where you can see the whole inside of the joint magnified. You start off by putting the camera in the joint, look through any damage in the joint, and then typically go out underneath the bone here, where a lot of the times we have bone spurs, and we can remove bone spurs, clean up inflammation, or repair muscle tears. In a normal shoulder, this is a left shoulder, you can see this overhang of bone comes from the shoulder blade, and you're supposed to have a wide open space here to allow for free movement of the head with the muscles underneath the bone. In some cases, we find that the space is narrowed and you have a bone spur that developed underneath for several reasons. It narrows the space, and now it starts rubbing on the underlying soft tissue structures, which can be either the bursa or your rotator cuff muscles, and cause inflammation or muscle tears from the overlying spur impinging on those structures.
So it was into hospital.
This is a video of the left shoulder. We're inside the shoulder joint. What we see underneath the round bit here is the head of the humerus. You've got this is your biceps tendon that we see. And behind that is the beginning of your rotator cuff insertion. Bit of frayed tissue there, but otherwise the inside of the muscle looks relatively normal. Underneath, we look at the right deep underneath into the axilla of the shoulder, normal, and there I go into the socket of the shoulder. Bit of frayed tissue, but we look at the smooth parts, which is the cartilage, and that's all normal. No arthritis in these joints, just a bit of wear and tear on the soft tissues, but otherwise a normal inside of the joint. We're now outside of the shoulder joint, and we're in an area where the bone is, with the overlying bone we were talking about, and there's the prominent piece of bone spur. I'm removing it with a small burr, which is 5.5 millimeters thick, and basically removing the excess bone to change it back to normal anatomy to avoid the impingement. Inflammation tissue is called bursitis in the shoulder, and that inflammation tissue happens due to the impingement of the bone on the underlying structures. All of that loose tissue I'm removing there is the bursal tissue, and that causes pain, and by removing it, we take care of that pain. The body forms a new bursa, which is a healthy bursa that doesn't cause as much pain. That is damage to the muscle due to the overlying bone spur, and the white you see in there is some calcification which formed secondary to chronic wear and tear on that muscle. So it basically is a tear of the top layer of the muscle. The tear hasn't gone right through, but you can see quite severe damage on that tendon due to the bone impingement. I clean that up, and there you see, and there's a bit of a bone defect there. We make little holes in the bone to stimulate bone marrow coming out and to help heal that defect. It looks very big on this ultrasound, on the arthroscopy, but that whole tear is about 12 by 5 millimeters in size. The shoulder is the most complex joint in your body, and therefore surgery and recovery after that takes a long time. The typical rotator cuff tear or serious damage to a rotator cuff will involve surgery where you stay overnight. You're typically kept in a sling for 6 weeks, and then a full rehabilitation program is commenced, which may take anywhere from 6 to 9 months. Most people have a full recovery after 6 to 9 months, but in severe cases may take up to a year.
A day later, homeward bound, with a very sore shoulder.